I know for sure diabetes awareness has increased in this country. Because I remember I've been a doctor for a while now. Initially, more than 10 years ago, when patients would come to my clinic and I do a random sugar test and find they're diabetic, most patients would break down and cry when you tell them they have diabetes, because to most people, having diabetes meant a death sentence. Because most people just knew people who had diabetes and had died, because most people were diagnosed late. Many of the children who have diabetes were never diagnosed to have diabetes, because most of the kids who come in coma would be treated for malaria, meningitis, typhoid fever, and definitely would die because what they were suffering from was a diabetic coma. We have seen a change because these days people are coming for testing, and therefore they are picked up to have the diabetes early. And we have also noted that when you tell somebody you have diabetes, at least they don't cry anymore, because they know now that you can live with diabetes positively. We want also to increase the awareness and management of diabetes as DMI among the healthcare personnel. We want the people who look after these patients to be well versed with management of diabetes, so that when people go to these private clinics or government clinics, private hospitals or government hospitals, they're in a position to be able to be managed well. So as DMI, we endeavor to increase the knowledge of diabetes in this country. And the other thing we do is, with the Ministry of Health and together with WDF, we've been able to put up a project whereby we've been going to different government hospitals and setting up diabetes centers. And in this diabetes center, this is a room or rooms in some of the hospitals where one can walk in as a diabetic patient, and you meet there a nurse, a nutritionist, a clinic officer, or a medical doctor who is well versed in management of diabetes. So this is a project that we've been carrying on for the last 3 years, and we've been able to have diabetes centers put in over 80 government hospitals around this country. And our goal is that as we continue with the project for the next 2 years, we'll be able to also educate people in the health centers about diabetes and put up blood sugar testing equipment in each and every health center with a blood pressure machine, because blood pressure is also very important in the management of diabetic patients. We also hope to put up in the dispensaries, have blood sugar testing equipment available. This is to ensure that people don't have to travel far to have their sugar managed or monitored. Because we know one of the handicaps we have is that yes, people are going to the district hospitals, but they're not able to monitor their sugars regularly. We also have been increasing awareness of diabetes through the media, doing a lot of interviews with print media, radio and TV. We also have been increasing awareness by going to schools. Before the diabetes walk, we always go to schools where we give a talk on diabetes and tell the students and the teachers and the other staff in the school about diabetes. Our goal would also be that we can have diabetes and other non-communicable diseases like hypertension, cancer, high cholesterol, obesities, which are diseases that have come upon us now due to the change in lifestyles introduced in the education system in Kenya. So that the same way students are taught about HIV and malaria, they can also be taught about diabetes, so that they are aware of these conditions and how they can prevent them, or if they occur, how they can live with this condition. We would want everybody who is over 35 at least to be going for regular testing every 1 or 2 years. And if you have a family history of diabetes, we would want you to have your sugar tested every 6 months. A fasting sugar would be good, because if you're diagnosed to have diabetes early, before the complications come in, then you can live with diabetes for a long time. It is known that if you already have symptoms of diabetes, the diabetes has been in you for the last 4 to 7 years. So you see, and the complications have already set in. But if you went for regular testing, then you would be picked up early before the complications. And therefore our population will be a more healthier population, though diabetic, because they do not have complications.